Morning. How's everyone? Right to go?
Yep. Go. Yep.
All good? Okay. Thanks everyone for coming along this morning, and I'm joined by Jerome Weimer, the COVID-19 response commander, the acting Cho, Ben Cowie, and also Chelsea Spence and Zhush, who you will meet in a moment. They'll be the stars of the show today. So I'll take you through, as normal, the COVID numbers. Then I've got a couple of important education announcements, and then we'll hear from Chelsea and then from Ben and Jerome. So there were 2,297 new cases of coronavirus yesterday. All were locally acquired, and we currently have 20,505 active cases. This is a significant jump in numbers, which we know will come as a surprise to many Victorians. We had hoped to see a plateau in numbers, but today's jump does still land within the projected range of the Burnett modelling. Acting Chief Health Officer Ben Cowie and COVID Commander Jerome Weimer will speak shortly to some of the trends in yesterday's cases, which gives us some insight into the shape and the movement of this outbreak. But in terms of the rest of today's update, sadly 11 people have lost their lives with COVID-19. A man in his 50s from Moonee Valley, a man in his 60s from Moreland, a man in his 70s and a man in his 60s, both from Melton, a man in his 70s and a man in his 60s, and a man in his 50s, all from Hume, a man in his 70s from Greater Shepparton, a woman in her 80s and a woman in her 70s, both from Knox, and a man in his 80s from Brimbank. These people are not just a statistic. Every one of them led a full life with family and friends who love them, and we pass on our deepest sympathies to their families and friends. We have 706 people currently in hospital with COVID-19, 147 are in ICU and 100 are on a ventilator. Of the people in hospital yesterday, 90% were not fully vaccinated. 82,762 tests were processed yesterday, another record testing day, so my thanks to all those Victorians, and 37,611 vaccines were administered at our state hubs. 87.6% of the over 16 population has now had a first dose of COVID-19 vaccine, and 62% have had a second dose. From 11:59 p.m. tonight, I can advise that the acting Cho has declared that the ACT will move from a red to an orange designation. And as I said earlier, these numbers are not what everyone wants, and I know that people will be feeling anxious about them. But they are in line with the modelling, and our goals are still our goals. This shows the importance of getting vaccinated, getting to 70%, getting to 80% as per our roadmap. Get the jab if you haven't, either first dose or second dose. Follow the rules. We are almost there. The faster we get to those vaccination rates of 70% and then 80%, the faster we're out of lockdown and the faster that we can ease restrictions. So that's COVID, and we'll hear more from Ben and Jerome in a moment. But I've got a couple of important announcements to make in terms of education. First, on some changes that the public health team and my department have made on the protocols to make sure that all VCE students, other than those confirmed positive, can sit their exams. And secondly, on some really important mental health initiatives for schools, and that's where you'll get to meet the star of the show, Zhush. So to VCE, and I know this has been front of mind for VCE students and their families. So from next week, to enable VCE exams to go ahead without disruption, significant changes will be made to how we manage school exposures and students who are primary close contacts. So all of us have been focused on making sure that for this exam period, our VCE students are as supported as they have never been before, and this announcement will give them a lot of comfort. So these are exciting changes made possible by the huge efforts of millions of Victorians who have stepped up to get vaccinated, and that of course includes our VCE students themselves. So more than 80% of 17 to 18-year-olds have now had their first dose, and over 75% are on track to be double dosed by the time we get to the written exams from the 27th of October. While they're completing their vaccination, we have a plan to help them safely complete their VCE exams. So students who are primary close contacts will be able to sit their exams Students who are primary close contacts will be able to sit their exams in a dedicated room with a separate entrance, either by themselves or safely distanced from other students who are also primary close contacts, depending on the school's capacity. They'll be supervised by staff wearing face shields and healthcare worker level PPE. The rooms will be safely ventilated and cleaned between each use. To help us keep the community safe, each student who is a primary close contact will need to be tested every 48 hours through the first week and after their exposure on day 13. So for students who are fully vaccinated, that means they're in isolation for 7 days. For students who are unvaccinated, they're in isolation for 14 days, but they have an exemption to go and sit their exam. That's the critical announcement that we're making today. The regular testing that I've just mentioned is the key to ensuring that students and the broader community are kept safe and making sure we pick up any further spread nice and early. The process for students who test positive for coronavirus will not be changing, so they won't be able to attend school or sit their VC exam, and they'll receive a derived examination score for any exam that they miss, and obviously there's the consideration of educational disadvantage process to make sure that every single student, their marks, any impact of COVID is reflected in their final results. In addition to the trial of rapid home testing for school communities that I announced a couple of weeks ago, we're now also working with the Department of Health on an additional wider trial of the use of rapid antigen testing in school settings as part of the suite of COVID-safe measures for school. And we'll have more to say about that over the coming weeks as we approach November 1, which is the indicative date for self-administered rapid testing, providing of course that individual tests are approved by the TGA. So that's the announcement in regards to VCE students. All students, other than those who are confirmed cases, all students will be able to sit every single one of their exams, and I think that's a terrific announcement that we're making today. I now want to move on to mental health, and I've said a number of times both the impact of COVID will have a long mental health tail, particularly with our young people, but the need was already there prior to COVID. We've had the Mental Health Royal Commission, the first of its kind in our nation, and what I'm announcing today goes to one of those key recommendations. So today we're launching the school's mental health menu. Back in the budget earlier in May, we committed $200 million to deliver more mental health support in schools, a key recommendation of the Royal Commission, and it's so vital that both responding to mental health concerns and the promotion of good mental health and well-being is promoted with children from a young age. It'll be the absolute focus as students return to face-to-face teaching through the course of the next couple of weeks. Well-being will be the #1 priority of schools, but this is about delivering a key recommendation that goes beyond the immediate response to COVID. So government schools will be able to choose from the initiatives that respond best to their unique needs and responds best to their students, and making sure that they get the right support at the right time to the right kids. So the support will come in 3 tiers. Tier 1, positive mental health promotion, and that includes initiatives like mental health first aid training, positive education and therapy dogs, just like Zhush. Tier 2, early intervention and cohort-specific initiatives, so things like cross-cultural responsiveness training or trauma-informed care. And then Tier 3, targeted support for those experiencing mental health issues, so direct additional mental health professionals working in our schools. The Royal Commission recommended that we prioritise this fund, firstly, to schools outside of metropolitan Melbourne, and that's exactly what we're doing. So every single school, every single government school in rural and regional Victoria have now got their indicative budget for next year. They know how much funding they're receiving for their school mental health fund, and that's why we're launching the menu today. So we're starting in rural and regional Victoria in 2022, and then progressively through metropolitan Melbourne over 23 and 24. So I'll now pass over to Chelsea and Zhush, and they'll speak about how amazing therapy dogs can be in schools. Therapy dogs, and Chelsea will go into the detail. It will be one of the initiatives that schools can choose and provide funding for, but don't hear it from me. I know how good therapy dogs are, but the broader community does need to hear it. So over to Chelsea and Zhush.
Thank you so much, James. Thanks so much, guys. My name is Chelsea Spence, and this is my beloved dog, Zhush. We are a team from Canine Comprehension, and Zhush is an animal-assisted education dog. We are thrilled to be a part of the school's mental health fund and menu. And at Canine Comprehension, we work alongside our animal-assisted education dogs and highly trained professionals to cater for students' mental health and wellbeing needs. Why dogs? Well, because it's scientifically proven that dogs increase our happy hormone, oxytocin, and they decrease our stress hormone, which makes it much easier for children to access their learning. We know that children cannot access their learning if they are stressed or have high anxiety. So that's how we use our dogs to help our kids re-engage with their learning. So Zhush and I have had the privilege of working for Canine Comprehension for many years, and we have got wonderful success stories at the company, and I'd love to share one with you about a young boy that we worked with. He had severe OCD, severe anxiety and depression, and he was completely isolated from his education and from his peers. He wasn't able to build friendships, he wasn't able to go outside and be with the other children, and he wasn't able to be a part of his classroom. As a result, Zhush and I came in, and within 6 months this child had completed a complete 180. He was a transformed, confident and happy young child. He was able to build friendships with others. He was able to go outside with the help of Zhush, and he was fully immersed in his education and his classroom, and it was fabulous. We just used to bask in the glory of this happy and confident child that Zhush and many other teams at Canine Comprehension had achieved with him. So we are so thrilled again to be a part of the school's mental health fund and menu, and we cannot wait to get out there and help the children and help education moving forward. Thank you so much. Thanks, guys.
Thanks, Chelsea and Zhush. That's a really, really hard act to follow. On a sadder and more serious note than the wonderful the outcomes of the program and Zhush and everyone involved, today is a big number of cases that's been reported, and I know that this will come as it will hit hard for many, many people in Melbourne and in Victoria. It does really show how easy it is for this virus to pass from person to person. There's no single event that we can really pin this very substantial increase in numbers relative to the last couple of days to explain it, but there are some trends which we are exploring and will have more information on, which start to build the picture. So 46%, nearly half of the cases reported yesterday, were aged under 30 years, and 63%, so nearly 2/3, were aged under 40 years. Within these new cases, there were 1,245 newly impacted households. So we will see these cases continue to generate further cases amongst their contacts in the days to come. And Jerome will speak in greater detail about the geographical spread in a moment. while we have seen increases across the board, we've certainly seen disproportionate increases in some parts of regional Victoria, and in particular we've seen increased growth in the southeastern suburbs of Melbourne, and believe that we do have undetected transmission occurring in the community, which is just coming to the surface. So this really re-emphasises the Deputy Premier's points about needing to keep safe, to look after each other, to stick to the COVID-safe principles, and to get tested as soon as you have symptoms, and of course to get vaccinated as soon as possible. So Melbourne has been through a huge amount. Victoria, and particularly Melbourne, through a huge amount, and we're all over it. We're tired and we all desperately want this to be over. But it's not yet over. We don't yet have the level of vaccination needed to protect us against numbers like this, and the onward flow of hospitalisations that will inevitably follow. However, we are seeing vaccination put a very substantial downward pressure on transmission. These numbers would be orders of magnitude higher were it not the fantastic efforts of Victorians coming forward and getting vaccinated already. So we just need to keep that process going to get every Victorian, as many Victorians as possible vaccinated, to get these numbers down, and equally importantly, to keep the numbers in hospitals where they are now and then trending downwards. We really owe it to our healthcare workers to protect the system as they protect us. So indeed, vaccination is our way out of this and has been for a long time. Every day we are getting closer to those 70% and 80% double dose figures, and we are absolutely going to get there in the coming weeks. But the job's not yet done, and we need to do more. And that's why we have put significant effort into hyper-localising the vaccine rollout with the new mini pop-up program, which started yesterday. So these mini pop-ups or mini pops complement our mass vaccination sites and even the larger GP and pharmacy rollout with opportunistic walk-up micro-sites on high streets, in shopping centres and in neighbourhoods. And each of these small pop-ups will aim to do a few dozen doses in a morning or an afternoon before moving on to the next location. Honestly, it's just about trying to make vaccination as accessible and as easy as possible to every member of the community. So for example, yesterday, our morning pop-up at Degani's in Mernda Junction did 37 doses in a few hours. And in the afternoon, we did another 40 doses at Aurora Village Shopping Centre in Epping. So there are clearly still people who are very receptive and wanting vaccination, and this is about building access as easily as possible for those individuals. And for some of them, the very close nature and the immediacy of a mini pop is the way to do that. So we are bringing the vaccination to them. And a final reminder that from tomorrow and throughout the weekend, we're running our pop-up vaccination site at the Melbourne Demons, with the Melbourne Demons, I should say, at Casey Fields. This site will be offering Pfizer and Moderna with both bookings and walk-ups available. So whichever team you follow, or even if you don't follow the footy, head down tomorrow from tomorrow to get your dose. And I'll hand over to Jerome at that point. Thank you.
Thank you, Ben, and good morning. Really, obviously a very challenging day today with 2,297 cases of coronavirus in the last 24 hours. Now well over 20,000 active cases of COVID in our community, really all across the state. The 7-day average of our cases is 1,781, which is broadly in line, slightly above the Burnett trajectory. And I guess Ben has indicated, we are now on the most challenging part of the journey where the destination is close in sight, but we've got some very big weather to get through over the coming days and weeks. And the coming days will tell us whether the numbers we're seeing today are a one-off or whether there are still a further growth in our numbers to come in the days ahead. Over a quarter of our cases today are under the age of 20, and as Ben has said, almost 2/3 under the age of 40. We all continue to see that vaccination plays a huge part in terms of people's likelihood of ending up with COVID. Let me put it this way, 12% of the adult population in Victoria is not yet vaccinated. yet almost 7 out of 10 of those people who are catching COVID are not vaccinated. The rate of getting COVID if you're not vaccinated is so far higher. With 62% of us now fully vaccinated, only 11% of people who are catching COVID are fully vaccinated, and 98% of people who are in ICU are not fully vaccinated. It is really important now that we conclude and drive on hard with our vaccination program. In terms of the numbers we've seen today over the last 24 hours, we're seeing significant growth in a number of regional locations, particularly Geelong, Shepparton and the Latrobe. I'll come on to those again in a moment. But we're also seeing significant rises in Dandenong, Kingston, Cardinia, Monash and Port Phillip. Again, a range of suburbs in the southeast and of course in regional areas. We're seeing lower levels of increase, although we're seeing increases everywhere. We're seeing a far lower rate of increase in Hume, Moreland, Whittlesea, Melton and Brimbank. So the picture's pretty clear in terms of what we're seeing again. We're seeing a significant shift and a far higher rate of growth in the southeast of the metropolitan area, and we continue to see some significant increases in case numbers in some regional locations. In the southeast, therefore, we have an increase on yesterday's numbers, so 650 cases in total in the southeastern suburbs. That's an increase of over 50% on yesterday. In our western suburbs, we've seen 633 cases, very similar number, an increase of 50% on yesterday. In our northern suburbs, 693 cases, an increase of 37% on yesterday. And we have 144 cases in our eastern suburbs, far lower number. That's an 80% increase on yesterday's number. In terms of regional Victoria, we have 170 cases in total across regional Victoria. That's an increase of a third on yesterday's numbers. And there are now 1,289 active cases across regional Vic. Key locations that we're focusing on, or the areas where we've seen the most significant increases, include Geelong with 32 cases. Most of those are linked and connected, but we have 9 still under investigation. We have 30 additional cases in Shepparton, and sadly we've had 1 death in Shepparton Hospital included in today's numbers that the Deputy Premier went to. Again, the majority of the Shepparton cases are linked to, we understand, the community transmission that's happening in Shep at this point in time. We have 23 cases across Mildura and Robin Vale and Swan Hill, again all linked into a number of communities and including into agricultural workers in that part of the state. And we have 17 cases in Latrobe and 17 cases in Balborshire. So significant work to do there, and we can now see a significant number of cases again in our regional communities that we're working very hard on with local players. In terms of vaccination, over 600 or just under 600,000 doses delivered last week by both GPs, primary care, community pharmacies and state clinics, and the whole range of pop-ups that Ben's described. We now have, for all Victorians over 40, 90% have now, at least 90% have had their first dose of vaccine, going up to 94% of Victorians aged over 70. So we're seeing really high rates of vaccination in those older age groups, which is fantastic to see. And 72%, or at least 72% of all Victorians aged over 40 are now fully vaccinated. So we're seeing and completing, the older cohorts are completing their vaccination journeys. It's important we maintain the momentum in our younger age groups to carry that work on. Finally, I had the opportunity over Monday and Tuesday to work with our teams in Mildura and Robin Vale and Swan Hill. And each of the cases we read out every day, these very high case numbers that we're seeing, entail a huge amount of work behind the scenes. So I'd like to particular shout out to the teams at Madas and at MVAC for the phenomenal work they're doing to support their community members who are living with COVID and trying to avoid COVID spreading further in their communities. The amount of work that those people are doing around volunteering, providing food and welfare relief, ensuring people can isolate as safely as possible is truly inspirational. And that story sits behind so many of the cases that we see in today's numbers and across our state. The health teams, the clinical teams at Mildura Base Hospital and at Swan Hill Hospital, the amount of work they're doing in Tier 3 PPE, getting ready potentially for worst case scenarios of seeing significant numbers of people being ill coming into their hospital environment. That is a story that's replicated across our entire state, and my thanks to everybody in our clinical and medical teams who are doing so much work behind the scenes to look after people who are today sick with COVID and also preparing for some very challenging weeks ahead. So although we can see our way through, and we can see our way through along the roadmap, we knew that this was going to be difficult. The numbers today highlight how challenging this is, not only for all of us as Victorians to navigate our way through this COVID pandemic, but particularly those who are catching COVID and those who are becoming seriously ill with it. Please, everybody, use this as a reminder for those last few weeks to do whatever we can to minimise transition, and please get vaccinated so you don't suffer the worst consequences that might happen. With that, I'll hand back to the Premier, actually Deputy Premier.
Thanks, Jerome. Happy to answer any questions.
Minister, have you considered, we've had such a great response to the vaccine rollout, there's a staggered start for preps to twos in the coming weeks. Is there any consideration perhaps getting those children back full time for those first weeks, given we've really exceeded our expectations on vaccination rates?
Well, there's probably two answers to that question. Obviously, in terms of the arrangements with the roadmap, it's about getting to 70 and 80%. The faster we get to those markers, the faster we can end the lockdown and ease restrictions. And of course, schools will be part of that consideration. So the focus for everyone, and the message that we've given again today, the best thing people can do is to get vaccinated and follow the rules. And the faster we're there, the faster that we can ease restrictions. In terms of the question of staggered versus full-time, this was a really conscious decision that the Department of Education and I made alongside public health advice, because it's been such a long period of lockdown on top of the long periods of lockdown that we had last year, that what we wanted to do was get as many students back to face-to-face teaching as quickly as possible. And the best way to do that was the staggered approach. So next week in Melbourne, we will have preps, grade 1, grade 2, back at school on staggered days through the course of the week. The same goes for the week of the 25th of October. In that week, we will have all students back. Some full-time, some part-time, but every single one of our 1 million students will be back face-to-face in front of their teacher and with their friends. So that's the reason why this year we went for a staggered approach for a very short period of time before all students return full-time.
How will positive cases be treated? Will the whole school or a whole class be treated as a primary close contact once you reopen?
So we're working really closely with public health on how we manage outbreaks and positive cases in a school environment, and I've spoken a number of times over the course of the last week or so. The intention is, for example, to if there's a positive case and we need to close a school, it'll be closed for a very, very short period of time, around a day or so, and that's to do a deep clean of the affected areas, identify the primary close contacts, and then get most students back as soon as possible. So the intent of the public health team working with the department is about ensuring that if a school is closed, it's closed for the minimum period of time, so we can do that cleaning around 24 hours or so, and also reduce the number of students. So it's not talking about students across the whole of the school, it's talking about those primary close contacts. It might be a class, it might be a bit larger than a class, but we're trying to minimise the number of primary close contacts and minimise the time that a school is closed.
In terms of the isolation rules for students, could you just clarify for me, is it if they're fully vaccinated, it's only a week?
Yeah, that's right. So if they're fully vaccinated, then it's 7 days isolation, getting those tests within 48 hours in that first week, and then obviously the day 13 test and an exemption to go and sit their exam. If it's an unvaccinated student, then that's 14 days.
And I assume that's the same for partially as well?
Yes, that's my understanding.
Do you have any more guidance on face masks in schools, given they're becoming mandatory for everything?
So there's guidance provided by the operational guidelines that are delivered to schools, giving support to principals in terms of how to implement this, and advice to parents. The message is really clear. If you're a student in grade 3, 4, 5 and 6 in primary schools, there's a requirement to wear a mask indoors. If you're a prep grade 1, grade 2, then it's strongly recommended. But we're taking a common sense approach. We know that this is hard across the board, but particularly with the little ones, it is a requirement. Schools know how to manage these issues, so it'll be treated just like any other part of a student's uniform, and our principals and teachers will approach it in a common sense way.
Exam scores will be derived probably from previous assessments. is there no way we could just get these kids a form of the exam that they could do at home as something a little bit different? Obviously, it would be marked differently. You'd have to, accommodate for cheating and all that sort of stuff. But isn't that better than just a derived mark?
No, unfortunately it's not. It's really clear settings from the VCAA. You need all the students to conduct, this is about written exams, with performance and oral exams. The approach to date and the approach for the rest of this week, if a student misses a performance or oral exam, the VCAA attempts to reschedule that because they're often single person events, dance, language, oral. With our big written exams, we need it to be done at the same time. So for any student that is unable to attend one of those written exams, then it's the derived examination result process, and this is very, very common. Every single year, there are students who are away because they're ill, they're sick, they've been in an accident, they can't attend the exam. Then schools use school-based assessments, their GAT results, and come up with a derived figure that is fair for that student. It's a normal process. Schools are very familiar with it. What we're trying to do, what we're attempting to do with this announcement, is making sure that we minimise the impact as much as possible. So today's announcement, every single VCE student, other than if you are a confirmed case, you will have the opportunity to sit your exam.
Do you have any idea how many of those students currently, I know exams are a couple of weeks away, but do you have any idea how many students are currently positive that may need to take that or have that derived score?
I don't have a figure of how many students are currently positive, and it will vary from day to day, and the number of students that are primary close contacts will vary. That's why we wanted to make this announcement today in preparation, particularly for the written exams that start on the 27th of October.
Are those isolation rules just for VCE students, or can primary school students have that 7-day or 14-day difference?
No, this is a VCE exam announcement, and the reason we're doing that, this is the most significant time in their schooling life, and we need to make sure and provide comfort to the students, to their teachers, their parents and carers, that we've got their back. And they can sit every single exam, even if they're a primary close contact. We're at all times working with the public health team in terms of what arrangements are in place. That's why we've been working very closely with them in terms of how do we deal with schools when there's a positive case, and we need to contact trace, we need to deep clean. It's all about minimising the impact. If and when we have more to say about other students, we'll do so. But today's announcement, given that we're in the exam season, is particularly about VCE students.
How's the ventilation audit going in schools? Some schools haven't received any air purifiers yet ahead of reopening next week.
Yeah, this is a rollout, and as we said when we made this big announcement, this is an Australian first. No other jurisdiction is doing this on the scale that we are. 51,000 air purifiers. There is massive global demand for these products, and that's why it will take a period of weeks and months, and we said that when we made the announcement. We're focused on our hotspot LGAs, and we've already got 2,000 air purifiers in schools right now, and then over the coming weeks and months, the remainder of the 51,000 will be delivered.
Minister, how many schools have currently been exposed to COVID, and do we have an update on Casey Grammar and Dandenong High School? The outbreaks in these?
I don't have an update. I'm not sure if Jerome has any particular update on those schools. So I'll hand over to Jerome.
So at this point in time, we've got 49 schools where there's been a positive case exposure over the last 10 days or so. Most of those schools are back and reopen again, and we're obviously working with the positive cases that are there and making sure they can isolate effectively. And as the Deputy Premier has gone to, we've adjusted and worked very closely with the schools to really minimise the number of primary close contacts that get caught up in each school-based exposure. So where children are vaccinated, if they're over 12, where they're in well-ventilated classrooms, where their social distancing protocols are in a good place, and where they're mask wearing, we can reduce the number of primary close contacts and obviously minimise the impact it has on their schooling at this time.
We're essentially an incubation period on from the weekend. How
Yep.
much of today's rising cases do you think is attributable to people essentially having given up on following the rules and going to other people's places, having picnics with 20 or 30 people on last weekend?
Yeah, look, it's probably a better question for Ben. I think so. The angle I'll give on this, Rachel, is that look what we're clearly seeing over the last 4 or 5 weeks is we're seeing a continued trend of week-on-week rises in case numbers, and those rates move around a fair bit. And if you look at the moving average, we're seeing a continuation of those rises. Particular concern around the southeast and the southeastern area from a far lower base, 4 or 5 weeks ago, has continued to rise at a faster rate than what we've seen. A relative cooling off in our northern suburbs and in our western suburbs. It's moved around a bit in the western suburbs. We're also seeing more people moving around in the last 10 days or so. If I look at mobility data for last week, again, it shows there's a bit more movement in the general community than there was the week before that and the week before that. So I don't think anybody's hugely surprised. If you look at the Burnett modelling, it indicated that turn point would be towards the back end of October. We'd all like that to be as soon as possible, and every day we search for the number that might indicate that we're turning. We'll see over the next few days whether today's number is an isolated peak or whether we're going to see another plateau that we've got to get onto.
And are cases necessarily converting to hospitalisation, the numbers of hospitalisations and deaths that you would expect from the numbers of cases, or is the fact that the vast majority of those new cases are young people saving us from those?
That's definitely a Chief Health Officer question. I'll go to Ben.
Well, Jerome, while I've got you there, you mentioned 600,000, if I'm correct, 600,000 doses last week. There was
vaccines.
Vaccinations,
Yep.
right?
Yep.
There was supposed to be 792,000 doses delivered by the federal government in the figures that I've been seeing.
Right.
Is there another 200,000 available, and will that be sort of flowing through?
There is heaps of vaccine available. So and I think as we've been talking about entirely through the vaccination program, it was always going to come in October and November. That's when the real volumes of vaccine start to arrive. We're burning through vaccine at a really high rate within the state clinic system. The GPs and community pharmacies are also going really hard now, and of course the majority of our numbers are now going into those all important second doses. But there is more vaccine available, whether it's Moderna, Pfizer, or AstraZeneca. Choose your poison, but you can go to any GP, any pharmacy, and any of our state clinics to get vaccinated.
Can we just say 120,000 a day or 150,000 a day based on volume? Is that a realistic number of vaccinations?
I think look, certainly within within the state system, we've got appointments out there. There is now the constraint for us now is probably demand in terms of people coming forward. So every single day we've got thousands of appointments available or walk-up facilities available, and as Ben's indicated, that's why we've gone down the mini pops route to bring vaccination opportunities even closer to people, particularly in those areas where we're seeing lower overall vaccine uptake. So we are definitely in that phase now. Again, my sense is that GPs probably have capacity as well as a community pharmacy. So now we're down to the last 12% of the adult population that needs to get vaccinated. Increasingly, we're going to have to work harder to get them to come through the doors. And also a big shout out to everybody to get their second doses done. This is the capacity is there to get those second doses done within whatever time frame is appropriate to your vaccine. So please, if you haven't got it booked in yet, get it done now.
We've talked about cases in Mildura before. What are your thoughts on that outbreak at the moment, and are they due to come out of lockdown?
Yeah, so a question for Ben around whether they're going to come out or not, but I think it's too early to call. Would be my humble suggestion. We'll obviously watch the data there over the next 24 hours. Look, what we've seen in Mildura is there's some vulnerabilities around certain parts of the community where we're seeing lower levels of vaccine uptake, and there's a lot of work being done by local players to increase that, and that's going to be a really important part to land. We are seeing a lot of connected social movements again in a younger age cohort. They're being well supported, and of course we're very keen to ensure it doesn't then branch out into the wider community. And we're seeing linkages between that exposure and in Robinvale and in Swan Hill. It's a very connected community, of course, in that part of Sunraysia. So there's no huge surprises, I think, to what we're seeing in Mildura. There's a very big response being led by a number of local players, including Madas, MVAC, Robinvale Health, and Mildura Health, and we'll keep working with them to land that.
We're about 2 weeks on, I think almost exactly from the day we learned about the grand final spike day, the middle of that week. Do you know if many of today's positive results are day 13 tests?
I don't believe so. So I think we'll look a bit further at the data coming through. But look, what we have seen, we continue to see that sort of 55% rate of new households that indicates that almost half of the cases each day, half of this, these 2,000, almost 300 cases yesterday, are all happening. Half of those are happening within existing households. So that attack rate continues to be really high. If we're seeing COVID within a household, very high likelihood that many other members of that household will get it. It's the same picture we've seen all the way along from this.
I think someone mentioned that there's fears of undetected spread in some areas. Is
Yeah.
that deciphered by the test positivity rate being really high in certain areas? And
Yeah.
where is that?
Yeah, so what we've seen over the last couple of weeks, again, we're increasing focus on the southeast. We're seeing a welcome increase in testing numbers in the southeast. We've recently expanded significant testing facilities down there, the huge site down at Casey now. So we're seeing a really high up and increasing levels of testing, over 25,000 a day in that part of the city. But we're still seeing a fairly high, positive detection rate of around 4% in the southeast. So, we're quite concerned about that. We'd really like to make sure that more people are coming forward for testing to make sure we get to the bottom of all those cases that might still be out there.
Is it 5% seen as like the worldwide standard of like an emergency level of epidemic in an area?
I'd need to get Ben to talk to that.
Is there any concern that people who are fully vaccinated are having much milder symptoms and therefore aren't getting tested in the proportions that...
I'll go to Ben for that as well.
Sorry.
This is great. I'll get Ben. Line
One
them up.
more for you while you're here. In terms of people who might be housebound and might be elderly or vulnerable, what are the vaccination options for them? Can they get people to come to their house and vaccinate?
It's a great question, Rachel. So, look, we've been working all the way since, I think, April, May, around how we provide in-reach vaccination to the more vulnerable members of our community. We've had teams, teams assigned, physically located in public housing for a few months and literally going door to door to enable people who are housebound and finding it harder to move around to get their vaccination done there. We have a significant program involving our disability liaison teams, again working closely with our disability services to provide vaccination in home and in an appropriate and an effective way to really reassure and give people the confidence they need to get vaccinated. And again, if people have got any concerns about reaching out to vaccination, get in touch with us and we'll find a way of getting vaccine to you. It's now just too important for people not to get vaccinated, and whether it's the mini-pop teams, the mobile in-reach teams we've got, the state clinics, or of course your GP or community pharmacist, please use any one of those services to get it done. Chief Health Officer.
Do we have an idea of where these cases are coming from? Are they linked to workplaces or the same households?
Yeah, so specifically talking about the cases today, clearly there's further investigation that needs to happen to be able to tie it down. We certainly do know that there's significant amounts of household transmission, as Jerome was saying. Half of these are new households and around half are households where there's already been a case. So household transmission continues to be a significant driver. If I could sort of append a question that came through earlier, which was what are we seeing in terms of what's the understanding in relation to the time sequence? Look, it is, you're absolutely right in terms of an incubation period. You would be expecting that a surge in cases on a Wednesday relates significantly to acquisition that occurred 4 days ago or so potentially over the weekend. So that's pretty anecdotal, and I wouldn't like to sort of tie it down and say, that's definitively what's happened. I guess if we could turn it in a positive way and say we can see the impact of mixing of people, particularly unvaccinated people, in terms of increases in cases. So to pick up what the Deputy Premier said at the start of the press conference, please, if you're not vaccinated, please consider coming forward right now and getting vaccinated. We have the doses. We've got more sites available than ever before. Please make this the time that you start on that journey to get us, yourself, your family protected and get us all further down the roadmap towards being free. The other question was, so certainly it's possible that sequencing has occurred over the weekend. More information will come through. There was another question about the hospitalisation proportion. It's less than 5% at the moment, whereas it was sort of up towards 10% during Wave 2 last year. So yes, absolutely, that's partly the age distribution of cases in this current outbreak in Melbourne. And that itself has obviously been shaped very substantially by vaccination. High levels of vaccination in more senior Victorians, leading to much fewer cases in those groups. So that is certainly a significant element in the hospitalisation proportion. However, even for people who have had their first dose of vaccine, we know that the onset of serious illness is reduced significantly in that group, even within the first couple of weeks of the first dose. So we will start to see increasing numbers of cases hospitalised as the vaccine levels get to those really amazing levels on a community-wide basis, where there might have been one case who's been, there might be a case who's had one dose of vaccine. That will happen, but there is a significant reduction in the likelihood that even after one dose you'll end up in hospital or certainly in intensive care. So the hospitalisation proportion is substantially lower. The other element there, I think, is the really extensive work going on between health services and by our GPs in terms of keeping people out of hospital, and things like the COVID positive pathways, ensuring that community-based care is being delivered to people who can be managed at home rather than requiring them to come to hospital, but keeping them safe and ensuring that they get the care they need, and appropriate escalation. That is also something that is operating at a scale that we've never seen operate at before, and that is also keeping people out of hospital where appropriate. So there's a few influences on that number.
Household visits and home renovations being tied to that 70% mark rather than that 80% mark?
So look, I think on a day like this is a reminder of why we've got the settings that we do and why the roadmap has been crafted to try and balance as much freedom as possible while still retaining those essential safety levels. So we are reviewing all of the elements of that. I mean, the whole government, and we give advice to government on that on a daily basis. I've got no further announcements on that today, and I just would really reflect on the fact that days like today, this is what we will see going forward. As we open up, we will see jumps in case numbers. As we do have increased mixing in the community, increased freedoms and people moving around, we will see this sort of bumpy road. There's no question about it. And the Burnett modelling, the national modelling conducted by the Doherty Institute, they all say that, they all show us, whilst the more we vaccinate and get that sort of downward pressure across the whole community on cases, and that's a really important aspect, that puts the downward pressure on the virus as we open up and start to mix again. It's the way we can do it safely, but we will see days like this in the days to come.
So there was talk of reactivating the roadmap 5 days ahead of schedule, given that we are tracking so well with vaccination uptake, but given we've seen a surge of 800 cases overnight to this total, how do you think that'll impact our roadmap now?
Yeah, so again, in the same way that on a first downward day you would never say, so that's the new trend, you would also be very unwise to do that on the first upward day after a few days downward. I think we will need to review what happens over the next few days to provide advice to government on that. I've certainly got nothing to add in terms of timing of moving down the roadmap. The roadmap's there, the progress is agreed, and you're absolutely right, it's set to vaccination targets, not case numbers. And the guardrails, or the safety measures within the roadmap, are much more tied to pressure on our hospital system than they are to just the number of cases on a given day. Our number of cases in hospital, as the Deputy Premier said at the start of the press conference, is around the same as yesterday, 706. That is going to go up. There's no way that that's not going to go up with the sort of days we had today, like the report of the cases today. But again, keeping those numbers down, keeping our health system able not just to look after people living with COVID, but actually to be delivering care to all the other urgent care that's required, is a really fundamental safety mechanism, and that's the guardrails around the roadmap rather than an individual day's cases.
There's no stabilisation in the numbers between now and Wednesday. Is there a prospect that there would be enough worry to delay the reopening, or are you comfortable with the current level of pressure inside hospitals that there's no prospect of that? Because the hospitalisations that stem from today's and yesterday's cases won't show up for weeks, obviously.
Yeah, so they won't show up for probably a week or two, you're right, in terms of when people get the symptoms and get testing and then come through and actually end up in hospital. We will start to see a signal around that probably in a week or so, and then through the following week. But we know that there will be hospitalisations that result from this, and this is the real tragedy. It's not just about the cases, it's about the stories behind it and the people who will end up in hospital and who will have loved ones who get really, really sick. We've heard testimony this week at the press conference of 2 really strong women who presented their personal narrative on this, and there's going to be more stories like that from today's numbers, and that's the real concern. In terms of the impact on the roadmap, I don't think that there's no way that I could possibly hope to look at one day's numbers and say, okay, so this is what this means for the roadmap. We'll, as we always have, continue to review every day look not just at case numbers but the story behind the cases to try and get a better idea of why it's happened and whether we can tie it to any particular settings that, whether it's a roadmap or other public health settings that we can address, just as we did a couple of weeks ago when we recognised a significant risk around essential workers and as a consequence advised government around the essential worker vaccination mandate to try and address that risk.
The Premier said I think yesterday that he was going to receive the updated burnout modelling this week. Has that been completed? And based on the current case numbers over the last week or so, do you expect that we're going to start pushing the upper limits of the hospitalisations in the burnout roadmap, which I think was 1,500?
Yeah. So on the first part of the question, the Burnet are regularly updating the model and providing it through to the government and certainly to the department. And so, yeah, we are getting regular sort of feeds on that, and another one is coming in this week. So that is absolutely true. It's incredibly useful. It's one line of evidence. There are multiple other lines of evidence we clearly use to make decisions to advise government on how to proceed. To the second part of your question, do I think we will hit the upper margin of those sort of guardrails in terms of hospitalisations? I don't see an indication that that's going to be coming into play in the coming weeks. I think the hospitalisation proportion remains low, and that's partly because of the youth of the cases involved, partly through vaccination, which is continuing to increase, and partly through those other mechanisms like COVID positive pathways, which the government is investing in very substantially to further bolster those under very significant pressure. And the clinicians are doing an amazing job to look after those individuals in the community. So no, I don't believe we're going to push those levels. But obviously we'll continue to review that on a day-by-day basis, and what everybody in the community can do to prevent us from hitting those levels is sticking by the restrictions, keeping safe, sticking with the COVID safe principles, and absolutely please go and get vaccinated.
Just one last. Oh, sorry, can I just really quickly, just on the AstraZeneca vaccine, the company behind it is saying that they're no longer going to be able to manufacture this locally. I just wanted your take on this.
Oh, as someone who received AstraZeneca, look, obviously the sort of the time course and the nature of the vaccine rollout in specific regard to AstraZeneca, I think no one would argue has been a little complicated over the course of the vaccine program. I would come back to the point that this vaccine has been used in millions of Australians, is highly effective, is one that we see has equal protection against ending up in hospital or in intensive care or losing your life compared to any of the other vaccines we use. So I guess my only reflection is it's been such a fundamental part of protecting Australians, and I'm just so grateful that we've had the opportunity to have that vaccine as part of our rollout, notwithstanding the fact that there has been complications, there's been rare but serious side effects associated with it, as there are with any medicine or vaccine. But I'm profoundly grateful that we've had it as part of our protection of our community, because there's millions of Australians who would be at risk of serious outcomes of COVID right now were it not for that vaccine.
Do you think that's a missed opportunity, however, given that there's been mixed messaging and the concerns of that rare blood clot being an issue?
Look, I think there's been plenty of discussion about that over the course of the last few months. We're in a fortunate position now that we have plenty of doses of all of the vaccines available for people to come forward and receive, and that there's essentially universal eligibility for people aged 12 and over. I think that clearly there's always a balance between risk and benefit in healthcare, in clinical care as well as in public health. Our duty is to try and communicate the relative benefits and the relative risks of everything we do. And in a public health context, that's very sensitive to what is going on in the community at the time, particularly with vaccination in a pandemic era. So the risk settings that appear appropriate at one part of the year are very, very different when you're sitting in the middle of the most significant outbreak we've faced.
Do you have a view on the extent to which Australia should be providing vaccine to countries overseas with low vaccination rates, particularly given, I guess, the risks around other variants coming from countries with low vaccination rates?
Yeah. So Obviously, we want to see as many people in the world vaccinated as we possibly can. That's the WHO's position. But in terms of allocation of Australian doses of vaccine, that's really a matter for the Australian government. I couldn't comment on it.
And with the ACT, what are you looking at when you downgrade that to orange? And what would New South Wales have to satisfy to be downgraded, given they're not chasing COVID zero anymore?
Sure. So there's a number of triggers that we look at in terms of what the current outbreak settings are in that community, so what restrictions are in play for that community, the total case numbers, clearly our sense of how well the testing, contact tracing and quarantine mechanisms are working relative to those case numbers. So there's quite a few metrics. We speak regularly with our counterparts, both at a departmental and at a sort of a ministerial level on a regular basis to get intelligence to inform these decisions. So there's a range of factors.
Do you think like 80% or 90% would be when you start looking at?
You mean in terms of vaccination coverage?
Yeah,
sure. So I mean, so that partly relates to actually the national plan and how state borders will operate going beyond those sort of thresholds, which is part of the National Cabinet decision around the plan. So certainly a strong desire, I think, from many governments in Australia to open up as much as possible once we hit those high thresholds, but that's all as part of the National Cabinet decision-making process.
Do you look at case numbers per capita at all? Because I think New South Wales's per capita case numbers would possibly be lower than the ACT's at the moment.
Yeah, so absolutely. You can't just look at coarse case numbers. You know, the per capita or per 100,000 population is a key metric we do examine. But as I said, it's not just about the case intensity. It's about how much information we have about those cases. Are they in quarantine? Are they household contacts of people already in isolation? So as an outbreak matures, if you like, and those figures start to shift, that gives us security that we know that that the situation's in hand. And obviously it's also in relation to the current levels of transmission in Victoria and the relative risk between the two settings, not just an absolute risk.
I know it's been asked before, but is it possible to get vaccination rates of daily cases perhaps in like the CHO release in the afternoon?
So certainly I think we'll be able to provide more information. I don't know that we could do it on a daily basis in the CHO release, whether it was a weekly release or something like that. Certainly I think that that sort of information is really, really helpful, and very happy to go away and talk with the department about making that more readily available for everyone to review. I think, yeah, I don't see any reason why we wouldn't do that.
We're hearing of job losses in the Education Department today. Can you tell us how many?
Job losses in the Department of Education and Training? No, I cannot.
I heard from people in the department had a briefing today via Zoom.
No, I mean there's usual processes in terms of budget and commitments that each department makes in terms of savings, but on the detail, I'm happy to come back to you later.
The other question was, with the air purifiers, you said to roll out and it could take months to get every class. By the time some of those classrooms are fitted out with air purifiers, are we going to need them anymore?
Oh, I think we will. I mean, I think masks will be with us for quite some time. The need for air purifiers will be with us for quite some time. The virus isn't going away. We're mitigating the risk as a community and as a country by increasing vaccinations, but there remains, as both the COVID commander and the acting chief said, a significant portion of our community that is not vaccinated. We know for children, for example, if you're under 12, there is no vaccine currently available for kids under 12. Now that may change over time, and I know the Minister for Health has made some statements in terms of TGA process, but that's still got a way to go. So, whether you're talking about the remainder of Term 4 or into 2022, the lockdown will end. We've got the roadmap. We know the pathway through this is vaccinations, but there still needs to be an element of risk mitigation, and who knows how long that will last for.
How many classrooms will have those purifiers next week? The proper start of Term 4?
So, as I said, this is a gradual rollout because the global demand is so massive, and no other jurisdiction is doing what we're doing. We've already got 2,000 air purifiers, HEPA filters, in our schools now. We're getting towards the end of the audit process, examining up to 20,000 different rooms across our building fabric in the state, getting us a great idea about where they need to be delivered and provided. We've got the rollout of the CO2 monitors as well. So it will take a process of weeks and months to get it fully rolled out. But I was upfront with the community when we made this announcement. No other Australian jurisdiction is doing what we're doing on the scale that we're doing it. And I can tell you, as soon as we place the order for those 51,000 air purifiers, we've got a pretty clear message that there's not much more else available, and other jurisdictions who were looking to make big allocations were not able to. You know, we got there in time to make this big allocation. We're bringing them in via air freight to get them in rooms as quickly as possible.
Still on the staggered return to school.
How much did you pay for 51,000?
I'm happy to come back to you, Paul, in terms of the funding for this program. I think the Department of Education did a brilliant job in finding a provider and securing this and getting it locked in so we can announce it and roll it out through term 4.
Just on teachers, do you have an expectation on what proportion of teachers are unlikely to rock up to work because of the vaccine mandate next week in your conversations with the union? Or
I can't give you an exact number because we just don't know, but what I can tell you is that it will be incredibly small. Incredibly small. It won't be zero, and there's not one cohort in the community. If you look at any sector of industry, of activity, there will always be a small minority that do not want to get vaccinated, but the vast majority of our education staff are absolutely fully on board in terms of doing what they need to do to keep themselves safe, keep their colleagues safe, and most importantly, keep their students safe. We've got a survey that's been out for a few weeks now. I think we're up to about 69,000 respondents, and about 98.5% are at least first dose vaccinated. So I've got great confidence in our teachers, in our education support staff and our principals. Everyone wants to do the right thing for themselves, for their families, but for their colleagues and their kids at school.
Still on the staggered return to school, are any of the schools that applied for variations for multi-age classrooms like Year 1, 2 or Prep 1 classrooms, are they still waiting to have those approved?
There's a process that is worked through with the department in terms of those very small schools where you've got small numbers of kids. Often, you know, you might have a school of 10 to 15 kids. You've got a class of grade 3 to 6 and prep to 2. I'll come back to you in terms of whether there are any schools awaiting a response, but I do know that there's a process to work through with between DET and public health.
Also on the roadmap as well, is there going to be a return to lawful protests as part of the roadmap? Is that being looked at currently?
Well, that's part of what people can do as part of public gatherings. So as we reach those targets, things that we're used to do in a COVID normal way, we'll be able to do, and that would include gathering in numbers, but that won't happen until we get to those triggers as part of the roadmap.
Just on another type of gathering, Muck-Up Day, will that be allowed to go ahead, and graduation as well?
Muck-Up Day?
Yeah.
There's a whole bunch of things that students, parents and teachers are really focused on, quite rightly. You know, for grade 6 students, the grade 6 graduation, awards nights, camps, excursions, sports activities, Muck-Up Days. As we head towards getting to that 70 and 80%, the department's working with the public health team. What we want to make sure is that the things that the broader community can do will be able to be reflected in what school communities can do. So I want kids to enjoy every moment of term 4, and I'll have more to say with the Premier about what 22 looks like for our school kids. But I want students to really enjoy getting back in front of their teachers, being with their friends at school, but also enjoying those momentous times as students get towards the end of primary school or the end of secondary.
Will students be sent home if they're refused to wear a mask when they open up?
As I said at the start, schools are best placed to deal with these issues, and the wearing of masks will just be like any other part of their uniform, and that's how schools will approach it. So in a sensitive way, in a common sense way. Obviously, if there's a medical exemption, that applies. So I'm really confident that schools will do their best. Our secondaries have been fantastic in regards to masks, and I know our primary schools will be as well.
And last question might have already been asked of the Premier, so my apologies if it's repetitious. But the opposition is looking into freedom of information documents around the justification of the curfew measures that have been the case. Will the Department of Health release the justification for the curfew?
Oh, look, under the legislation, freedom of information processes are really clear. I do not sign off on freedom of information requests. There's a clear process within the Act, and I'm sure that'll be followed through on this issue or any other issue.
Will the department release them without a freedom of information request?
Look, I'm not going to speak off the cuff. I don't know what documents you're talking about. There will be a freedom of information process that'll be responded to accordingly. Awesome. Thanks, everyone.
Thank you.